Okay, so you've been told that you have gingivitis. That's not such a big deal, and you've heard that most people have that disease. It can't be that serious, right? Well, you're right that most people do have some form of gum disease and don't even realize it. But it is important to treat gum infections. The surface area of the gum tissue is about the same size as that of the palm of your hand. You wouldn't ignore an infection in your hand, so why would you ignore an infection in your gum tissue? Recent scientific research has shown that the gum infection is caused by bacteria living in a community called a biofilm. The biofilm creates a sticky slime covering and is not easily removed. And while still important, for most people, brushing and flossing alone are not enough.
My gums were starting to bleed, and my teeth even seemed a little bit more sensitive.
I have very sensitive gums, and they always bled every time I flossed, and I got very frustrated.
And my mouth didn't feel real clean, so I thought, well, maybe there's some gum disease going on that I don't really know about.
A biofilm is a community of many bacteria and their protective slime layer. Once the community is formed on the teeth, the bacteria cover themselves with a layer of carbohydrates, proteins, and other products for protection from outside factors. If bacteria growing on the tooth side of the biofilm produce acidic products, the patient develops tooth decay. If the bacteria growing on the tissue side of the biofilm are able to invade and infect the gum tissue, the host has gum disease. Without treatment, the infection can compromise the health of your teeth and gums. According to the 2003 World Health Report, approximately 85% of adults have some form of gum disease. In the early stages of gingivitis, you make enzymes to break down the bacteria. However, the layers of the biofilm are hard to destroy. They can become calcified, and this is called tartar and calculus. We have to make more and more of these enzymes until there are so many that the gums often bleed and become tender or puffy. Left unchecked, this cycle escalates, and the substances that our bodies make to break down the bacteria can also break down the fibers in the gums. The gum tissue is now weakened, and it is not held tight against the tooth. This allows more food and bacteria to be forced into the area and makes you that much more susceptible to disease. The longer the disease is allowed to progress, the more the structure is broken down. All of this can lead to a receding gum line and teeth that appear longer. Remember the saying that you get long of tooth as you get older? Gingivitis is one of the causes for this gradual breakdown.
I always had some infected gums, and no matter what you do, it always comes back.
Figured if I brush a little more, a little harder, that would help, and it did the opposite.
In the past, when you were diagnosed with gingivitis, we had no alternative other than to recommend that you brush and floss better. And certainly brushing and flossing continue to be important. But for most people, these are not enough, and they need professional treatment. During the cleaning process, we are able to remove plaque and tartar and reduce some of the bacteria involved. Now we have an additional treatment called the Perio Protect method that includes a custom-formed prescription tray to place medication prescribed by your doctor into the infected periodontal pockets.
I could do it at home. I didn't have to have an appointment to go see anyone, that it was up to me to actually make sure that I got the process done in the way that it was described.
I stick them in and hop on my exercise bike for a while or watch television.
You put the gel, mix it up with a little brush, and you put it up. It clamps on immediately. Very easy to use.
There are two primary reasons why the Perio Protect method is so effective. First, it overcomes something called crevicular flow, and second, it is able to break down the layers of the biofilm. Between your teeth and your gums is a small valley or pocket called the sulcus. It's only 1 to 3 millimeters deep. There are special cells in the sulcus that form a fluid like saliva that flows out of the pocket. This is called crevicular flow and helps keep the area clean too. Since the condition is an infection, many dentists have attempted to help patients deliver antibacterial medications, like mouth rinses, into the sulcus to help kill the pathogens. But the crevicular flow flushes out the pocket almost 40 times every hour, so any medicine or mouth rinse placed in the pocket gets washed away almost immediately. And the worse the infection, the more the crevicular flow flushes the medication out of the sulcus. And remember that biofilm? It is almost impervious to most medications because they are not held in place long enough to be very effective. The prescription tray prevents medications from being quickly washed away, allowing time for the medications to fight the biofilm infection. Medication can be prescribed to help break down the protein that coats the teeth where bacteria attach and obtain some of their food. And when the coating is broken down, brushing and flossing may become more effective. The Perio Protect method overcomes previous obstacles, is easy and comfortable, and is a very effective option. Medicines delivered with the prescription trays, which are worn for minutes each day, help manage your infection. Improved oral health may also benefit your general health. Research shows an apparent relationship between gum infections and more serious systemic health problems, such as heart disease, blood clots and strokes, type 2 diabetes, and premature or low birth weight babies. Now that you understand what is going on in your mouth and some of the options you have, you can take control and put yourself back on the road to a healthy smile. Please don't hesitate to ask your dentist or other medical staff about anything you have heard here.
I feel healthier.
I really feel good about smiling again.
My gums aren't sore or sensitive like they used to be, and they all seem to be more of a uniform color, a nice healthy pink. So I'm happy with that, and hopefully I'll get to keep my teeth longer.